COVID-19 is a strangely and a tragically selective disease. Though it can affect anyone, there are some people who are more likely to contract the infection and have a severe illness than the others because they have characteristic medical conditions that increases the risk. It is important to learn about the risk factors for COVID-19 because it can help us to take precautions in our daily life, understand how a medical condition can affect health when affected with COVID-19, help us reduce the risk for a severe COVID-19 illness by managing the high-risk condition. In the following presentation, we will be knowing how these conditions make people more vulnerable to the COVID-19 infection. Let's start with age being the foremost risk factor for COVID-19. There is a clear and a considerable age dependency for the infection and the outcome risks by multiple folds in each case. The newborns can be affected during childbirth or an exposure to a sick healthcare giver after delivery. Children under the age of 1 year with certain underlying conditions are definitely at an increased risk. Children under the age of 2 years. Although rare, children under the age of 2 years appear to be at a higher risk, and this is mainly because of their immature immune system and the smaller and the shorter airways, which make it more likely for them to develop breathing issues when affected with the respiratory virus. Moving on to the older group of children, even if affected, they are asymptomatic as they mount a less intense immune response, which is due to the differences in the expression of the ACE2 receptor to which coronavirus binds to in the respiratory tract. According to CDC, the risk of death from the disease starts rising sharply after the age of 40, rising dramatically with every additional decade of life. And this is mainly due to the immune senescence, which reflects the deterioration of the function of both acquired and the innate immune system. The lung tissues also become elastic over time, which is again a matter of concern. And the inflammation in the older individuals is also stated to be an exaggerated response causing multiple organ damage. These are the factors which make the people of different age groups to contract the SARS-CoV-2 infection. Moving on to the gender differences. There is an increased incidence of infection and death in men than women, and it is because of the following factors. The higher contribution of the pre-existing comorbidities such as the cardiovascular diseases, hypertension, and diabetes. And social factors such as chronic smoking and intake of alcohol also added to the list. Women are functional mosaics for X-linked genes, and the X chromosome contains a high density of immune-related genes. And therefore, women generally mount a stronger innate and adaptive response than men. This also results in a faster clearance of pathogen and greater vaccine efficacy in women than men. But this also unfortunately contributes to their high susceptibility to the autoimmune diseases. There have been reports which suggest that the ACE2 gene located on the X chromosome is responsible for the higher levels of the ACE2 enzyme in women, and thus it plays an anti-inflammatory role, and women are more protected than men. Let's see the role of genetic factors. Human genetic factors may contribute to the extremely high transmissibility of the SARS-CoV-2 virus and also to the relentlessly progressive disease of COVID-19. This has been observed in a small but a significant proportion of individuals, and these factors are largely unknown. There is an article on Biomed Central which was published on the 15th of July 2020, where the study included the investigations by examining the DNA polymorphisms on the ACE2 gene and the TMPRSS2 gene from around 81,000 human genomes. It was concluded that the ACE2 polymorphisms were found to be associated with the cardiovascular system and the pulmonary conditions by altering the angiotensin and the ACE2 interactions. The TMPRSS2 polymorphisms offer potential explanation for differential genetic susceptibility to COVID-19, as well as for the risk factors like cancer and the other high-risk group of male patients. These polymorphisms in the ACE2 and the TMPRSS2 are likely to be associated with genetic susceptibility for COVID, which calls for a human genetic initiative for fighting the COVID-19 pandemic. Let's move on to know how the superheroes of today's world are at an increased risk for contracting the SARS-CoV-2 infection. Yes, you're right, I'm talking about the frontline healthcare workers. The frontline healthcare workers had a significantly increased risk for COVID-19, and the highest was seen among those who reused the personal protective equipment. However, the adequate supplies of the PPE did not completely mitigate the risk, did not completely mitigate the high-risk exposure because of the presence of the unavoidable and undeniable factors such as the work overload, absence of isolation rooms, poor infection control, environmental contamination, and the pre-existing medical conditions of the healthcare workers. And not to forget the major role played by the subclinical or the asymptomatic SARS-CoV-2 infected patients in the nosocomial transmission, especially when the aerosol generating procedures are performed. So these are the factors which have put the healthcare workers at an increased risk to contract the SARS-CoV-2 virus. Let's move on to discuss the role of pre-existing comorbidities as the risk factors for COVID-19. Starting with COPD, the chronic obstructive pulmonary disease. It is not an absolute factor because having COPD does not make anyone more likely to contract the SARS-CoV-2 virus. However, COPD can set a stage for a more severe infection because of the pre-existing scarring, inflammation, and the lung damage. Moving on to the cardiovascular diseases as a risk factor. Although COVID-19 affects the airways and the lungs, all the organs work together with the heart to drive oxygen to the body's tissue. When the lungs are overtaxed due to an illness, the heart has to work harder, which creates challenges for people with a pre-existing cardiovascular disease. And the CVS can also be affected by tissue tropism or indirectly by the inflammatory response in the form of innate immunity. The American Heart Association also states that a viral illness similar to the COVID-19 can increase the risk for myocardial infarction by inducing a plaque rupture in the vessels and thus block the blood flow to the heart. These are the factors which make people people with a pre-existing cardiovascular disease to suffer from a severe illness. Moving on to the role of diabetes as a risk factor. Both types of diabetes increase the risk for COVID-19 illness because it's hard for people living with diabetes to fight off a disease in general or an infection in general. And more so, the poorly controlled blood sugar can make it more dangerous by being a ground for inflammation and weakening the immune system. And this is known as the hyperglycemia-induced immune dysfunction, where there is damage to the neutrophil function, depression of the antioxidant system, and humoral immunity, causing the micro and the macro angiopathies. Type 1 diabetes is also considered as a lower risk factor for contracting the SARS-CoV-2 virus. And it is mostly because of the following reasons: the lower age of the individual suffering from the type 1 diabetes, the low prevalence of type 1 diabetes worldwide, and there are studies which also suggest the increase in the levels of the CD8 markers in those suffering from type 1 diabetes, and hence plays a protective role to the people suffering from type 1 diabetes. Moving on to the chronic kidney disease. Kidney is the second most affected organ. ACE2 is highly expressed in the healthy kidney, but in a kidney disease, it is associated with a reduction in the renal ACE2 expression, possibly facilitating the damaging effects of angiotensin II in the failing kidney. And people with CKD require dialysis quite more often, which again weakens the immune system, making it harder to fight the infection. Moving on to cancer. Cancers such as leukemia, lymphoma, myeloma make people more vulnerable to contract the infection. And additionally, the cancer patients undergo various treatments which include the chemotherapy, immunotherapy, and radiotherapy, which again hampers the immune system, making it less active to fight a contracted infection. Let's see the role of HIV/AIDS as a risk factor for COVID-19. There has been a study which states that the HIV-positive patients who died of COVID-19 had pre-existing comorbidities such as obesity, poorly controlled diabetes, hypertension, and the other risk factors. And this draws us to a conclusion that it was these comorbidities which could have been the main reason for the death in these individuals. And therefore, we can conclude that those with HIV who are on an effective antiretroviral treatment are at the same risk as the people who do not have HIV. And those HIV positive patients who have very low CD4 counts, high viral load, and have suffered from a recent opportunistic infection are at an increased risk. Moving on to organ transplantation. Researchers emphasize that the need for caution in performing the transplantation at this time because it has been anticipated that the recipients may have a more intense and prolonged shedding of virus, which potentially increases the risk of transmission to risk of transmission to contacts, including the healthcare workers. And the transplant recipient also require the immune suppressant drugs all through their life, which again makes the immune system less active to fight the contracted infection. Now let's see the role of asthma as a risk factor for COVID-19. The American Academy of Allergy, Asthma and Immunology states that there is no current evidence of increased risk in those with asthma, although CDC states that the patients with moderate to severe asthma could be at an increased risk for a more severe disease. However, there is no published data to support this determination. Nevertheless, it's always important for asthma patients to keep their asthma under possible control. Moving on to pregnancy. It's a hyperdynamic state associated with hypercoagulability and a weaker immune system. From what we know, pregnant women might be at an increased risk for severe illness from COVID-19 when compared to non-pregnant women. And it is because of the striking resemblance with the immune state of COVID-19 characterized by the decreased lymphocytes, decrease in the level of NK cells, and increase in the pro-inflammatory markers. The European Journal of Obstetrics, Gynecology and Reproductive Biology also states that there are more ACE2 receptors on the villus cytotrophoblast and the syncytial trophoblastic layer, which might increase the risk of the vertical transmission, that is a mother to the baby transmission. So these are the factors which make pregnant women more likely to contract the SARS-CoV-2 virus. Moving on to obesity, one of the most important conditions that increases exponentially the mortality risk of the SARS-CoV-2 patients. Patients with BMI greater than 30 are affected. In obese individuals, adipose tissue interacts with the immune system, facilitating the severity and the lethality of the disease through biochemical, molecular, as well as the immune interplay. The nutritional pattern of these individuals, which includes high fats, high carbohydrates, high cholesterol, high proteins, excess salt intake, and low fibers, is also associated with an impaired inflammatory pathway. Obese individuals also suffer from a lot of comorbid factors, which makes them more likely to suffer from a severe COVID-19 illness. Lastly, discussing the hematological disorders like sickle cell anemia and thalassemia. These are the chronic conditions, and they're also associated with other comorbid factors, as well as the complications of chronic blood transfusion, which make them more likely to suffer from a severe COVID-19 illness. I would like to summarize my topic by stating that people of any age, even children, can be affected with COVID-19. And the risk sharply increases with increasing age, and people of age 85 years or older are at a higher risk. And those suffering from chronic health conditions of the cardiovascular system or the respiratory system and metabolic conditions like diabetes and obesity are also at an increased risk. And the weaker immune system due to pregnancy, organ transplantation, cancer treatments, dialysis, and HIV/AIDS also predispose the people at an increased risk. I would now like to conclude by asking each one of you to read this prayer for a pandemic written by Mrs. Cameron Wiggins in the month of March, which is in the month of March, which is very much relevant to the current times and the need of this hour. I hope and pray that this pandemic may end soon. I would just conclude, I would now like to end by quoting that whether or not people are in the high-risk category, everyone needs to protect themselves and others from catching or spreading the COVID-19. I'm very thankful to each one of you for having paid attention to my presentation. And I would once again like to thank my professor and mentor, Dr. VIJAYMOHAN, for having given me this opportunity. Thank you.